Good morning, everyone. Welcome indeed to this, the first of our thematic ecosystems on skills for health. My job today is just to moderate, is to listen and learn, which I'm sure many of you will want to do as well. So welcome to all of those. I can see the numbers increasing as we speak. So we have a very packed program today. So I suppose my welcome would also be to say the following. I know all the speakers are very experienced, but would like them to please stick to the timetable we have laid out. We're trying to do a lot, in 2 hours to cover a very complex subject with very expert speakers. And we want to give as much time as possible to those who may want to ask questions during the session. So, you all know by now how to work on Zoom. So if you've got question and answers, there's a question and answer chat box there. I will look at all those as we go through the sessions and raise as many of those as possible to the speakers for the appropriate workshops. I should have said my name is Brian O'Connor, the chair of the Alliance, and I'm delighted to welcome this particular ecosystem into our many other both geographic and thematic ecosystems. So the first session is first of all for Andy Bleedon, who's the ecosystem director for the Alliance, to give a very short presentation to explain the purpose of this, the structure of it, and what we're trying to achieve during it. So over to you, Andy.
Thank you for that, Brian. Share my screen. As Brian said, my name's Andy Bleedon. I'm the Ecosystem Director for the European Connected Health Alliance. What I'm looking to do today is to give you an overview, a little bit about, for those people who don't know anything about us, about who we are, but most importantly, what we're developing in terms of thematic innovation ecosystems and why. For those people who don't know us, who are new to the European Connected Health Alliance, we're a member organisation. We have over 800 members across the globe, 95% of which are government bodies, public agencies and not-for-profits, universities. Within that, we have over 120 hospitals, 225 universities, 70 patient groups, 67 municipalities and government agencies. So what we can bring to the table is need. What we're here today to do is to talk about how we work in a more thematic way within an ecosystem. Many of you will be familiar with an ecosystem. That's the tool we use to connect up all those members that we have in a permanent multi-stakeholder gathering, usually geographic, but in this case, thematic. The principle, though, is exactly the same. Because they're led with a need, with patients and citizens at the centre, we still see thematic ecosystems as being there to break down silos, to transform health and social care delivery, and also to create economic growth, but with a deep dive. That's come about partially because of the pandemic, but partially because of the growth in the number of ecosystems that we have across the globe, which has doubled in the last 2 years. What the pandemic has given us is a great need to go online and become virtual, but also our ecosystems have asked us to create a home for a more permanent, horizontally based, thematic approach to some of the key issues and challenges that they face. What that gives us is an opportunity to host a brand new set of ecosystems where we can provide that home, that dedicated repository, those social media communities, that platform and the webinars, which to enable our ecosystems to work on what are their topics that they've chosen. Now, our ecosystems have come together and prioritise the following areas, which you can see in front of the screen, in front of you. But today's topic is skills for health. Why are we kicking off with that first? Because our ecosystems all, when we've met them as part of our coordinators call, expressed that this was their number one priority. What they want to do within the skills for health thematic is still develop that permanent series, still have that multi-stakeholder involvement, still lead with a need and match up need and solution with the best practices, but on a global scale, not on a small geographical region, so we can bring in the best, whether it be from up in Finland with our Finnish ecosystem, with the ecosystems that you're going to see here today, which are taking place within this program today as part of our first ecosystem, or whether it's DHI, who we'll be hearing from later on, or from the HSE in Ireland, or quite excitingly for us, the Canadians who will be listening to this later on today because they're still hopefully safe and sound in bed. But added to that is the valuable tools and resources we're bringing in from across the globe, from Australia, from our Melbourne ecosystem. Because in Australia, as you can see here, they've already developed a national health, workforce and education roadmap. Why shouldn't we bring in best practice when it's already there? We've done too many years of reinventing the wheel. And then lastly, we want to bring in best practice from within industry. So some of our members, like Connected Health, have their Connected Academy, which has already been delivering online training in a scale and a pace never seen before. So we're really excited to bring those players together. But as I said, these are permanent. So we're going to be looking at future events, either on data and health and digital literacy, on system-wide change training, on using the need for unpaid carers to be skilled up, because we've just received our 800th member who happens to be Euro carers. They represent unpaid carers. So that's a direct voice of the need within this setting, within this thematic. But we also want to look at coaching and onboarding and training the virtual workforce. These are permanent. So our next ecosystem following this will be in July, and we'll be targeting the area of value-based healthcare skills. We'll be interested to hear your input and hear your questions today. That's enough from me. I'm going to hand back to Brian and welcome you all to our first thematic ecosystem for Skills for Health.
Thanks very much, Andy. That sets the scene. I'm delighted now to move on to the first panel of today and to welcome in particular to talk about the European Commission Pact for Skills, Maya Matthews, who many of you may well know, Head of Unit Performance of Health Systems at DG Sante, and particularly like to welcome George Valiotis from the EU HPP Thematic Network. I think these two people can give us an update on where they are and what the Commission and others are doing. And really may perhaps pose some question to some of us, because it's not just a matter of listening this morning, it's also of reminding you that you have every opportunity in a Q&A coming up afterwards to ask Maya and George questions. So to begin with, I think ladies first, if that's not old-fashioned, I'd like to ask you, Maya, to begin your presentation.
Thank you, Brian, and thank you, Andy, for that excellent introduction to this very exciting initiative. So I'm also here to listen. I'm looking forward to hearing about the different best practices that you will be presenting later on. I'm here and I'm delighted to present to you the Pact for Skills. The Pact for Skills was launched in November 2020 by the Commission, and it aims to mobilize all partners to reskill and upskill as part of the recovery, but also linked to the industrial strategy. The industrial strategy for Europe is really looking at how within Europe we can match the skills that are needed to move into the 21st century and to make Europe a competitive and a growth continent. The Pact for Skills is really aimed at stakeholders, and it promotes joint action from all stakeholders to improve existing skills and also to train new skills. It calls on industry, it calls on employers, it calls on social partners, chambers of commerce, public authorities, education and training facilities, and NGOs to really come together and to call for a clear investment and commitment in training. Within DG Sante, where I am, basically health is my area. And within this industrial strategy that I was discussing, they've identified 14 ecosystems. Not quite exactly like your ecosystems, but the general idea is there. The idea is that these are broad sectors of industry and society. And each ecosystem needs to have the kind of training needs and the skills for really bringing it to fruition and to be competitive and to have that kind of economic boom that we're looking for. So within the health ecosystem, we were asked as DG Sante to create a roundtable in close collaboration.
Have we lost Maya for the moment?
I appears so, yes. I'll message her and let her know she's done. We bring in George in the meantime.
Maybe.
Sorry, I'm back. Yeah, sorry.
Maya, you're back.
Yeah,
please.
I don't know what happened there. Very sorry.
Not to worry. Keep going.
Yes.
Keep
okay.
going.
So basically, we were asked to develop this health ecosystem roundtable, and the first question was, what do we think is the most important for the health ecosystem in terms of upskilling and reskilling? And we had a big discussion within the Commission, because I want to reiterate that this is a real Commission-wide endeavor. And we decided that we wanted to focus on the healthcare workforce, that it was too much to try to develop a discussion around all the skills that are needed for also the health industry. So what we decided to do is to focus on the healthcare workers and to have a bit more of a discussion and try to bring the people together. We thought it was important to also have a topic to focus on, and that was digital skills. So that was our starting point, and we held this roundtable on the 16th of February. We had 10 speakers from different sectors, so the private sector, from NGOs, from think tanks, from the professions, and with the idea to really look, as I said, at the needs, challenges, and opportunities. Some of the issues, and I would like to also say that the importance that was given to this roundtable was the fact that it was hosted by 3 commissioners, Commissioner Kyriakidis, Commissioner Breton, and Commissioner Schmidt. And some of the issues that I wanted to just briefly mention that came out of the roundtable. Although health is a highly regulated sector, as we know, we still felt that there was a lot of importance that different stakeholders can bring in terms of what's important for the skilling, where the education and training could lie, and most importantly, what are the key areas that we need to work on? What are the bottlenecks and what are the solutions? So the first outcome, which we were very happy about, was the fact that there was broad agreement that indeed digital skills is a very important issue for the future health workforce. It's also a key part of really the transformation of health systems. Some of the issues that were raised by the different stakeholders, and I would invite you afterwards, I think I've seen on the chat that you've already put the web link to the Pact for Skills, is the fact that the most important thing with digital skills for the professions is that digital skills should help health workforce. It shouldn't hinder, it shouldn't be an additional burden. When we spoke to many of the health professionals, they said that digital skills should help them to alleviate a lot of the perhaps administrative burden so that they can spend more patient face-to-face time. There was also a clear message that the role of patients in developing training, in developing these skills, needs to be taken into consideration. In fact, it went further to say that the role of health workers and patients in digital skills can sometimes be very symbiotic, that we need to really look at how education and training, in terms of now where we have more sensory and digital tools, where there is where patients might be in one location and the health workers in another location. These are really skills that need to be developed together with the patient and the doctor. It was also very clear that all of this skills development around the digital health agenda, it needs to be integrated in the curriculum, but there also needs to be incentives for them to be used. We've seen now, I think the pandemic has shown all of us that when there's an emergency, when there's an urgency, you can accelerate innovation. telemedicine, digital health has absolutely been accelerated, but we need to harness that. We need to make sure that this new innovations that we're seeing are integrated and there's regulatory frameworks for them. Finally, because I don't want to take up too much time and I would like to discuss and hear your questions, another important issue that came up was trust, and the fact that with all of this new digital technology, we need to build an atmosphere of trust. We need to make sure that the artificial intelligence that has huge potential for the health sector and algorithms that are used, there needs to be a trust framework. So not only for the health professionals to trust what they're using, what they're being trained to do, but also for patients. Finally, I want to also say that the roundtable acknowledge that digital skills are not the panacea for everything. It's not going to solve the health workforce shortage we have. It's not going to solve the working conditions or the fact that you might have concentrations that there's not equally, there's big coverage problems. But everyone felt that if we can get these digital skills right, if we can really make the sea change that's needed, it could actually make the profession more interesting and more attractive. And finally, the fact that other areas of workforce skills, for example, advocacy, leadership skills, soft skills, as well as big importance on primary healthcare. These are all areas that the group in the stakeholders group felt was very important. So to conclude, of course, everyone's asking now what the next steps are. So as part of the Pact for Skills, DG Employment will have by the end of this year a kind of a networking hub created for partners of this Pact for Skills. So the idea now is that we hope that the speakers and the 25 observers that were in this 16th of February roundtable would take the mantle, if you like, and to come together under a partnership and then be able to look at basically some solutions, some commitments, some actions that they wanted to do together and put this under the mantle of the Pact for Skills. I think that this is a good opportunity to then move to George, because George will talk about one possibility through the DG Santé's health policy platform, where a thematic on skills for health workforce already exists. So I wanted to just stop here by giving you a flavor of where we are in the roundtable on health, and to say that there's still a lot of work to be done. But I think from hearing the huge wealth of information and interest that's out there, I really hope that by the end of the year, we could actually have a partnership on health under the Pact for Skills. Thank you very much.
Thanks very much indeed, Maya. And I would thank those who have put all of the links on the chat already, and encourage you all to take time to read and understand those, because too often there's many documents come out. We don't always have the time or take the time to actually understand other than headlines. There's a lot in those. We've already read them in advance of this meeting. And I think that the leadership shown by yourself, Maya, and your teams there is very welcome, because this is an area which is obviously fundamental for Europe. And when you look at the list of people who are attending today, many of them are people who already have needs, who already have solutions. And the purpose of this ecosystem is to keep them together as a team, so that we don't lose out and just have a one-off event. Everybody goes, yeah, that's another thing we must think about sometime. So I'm a great believer in continuity and methodology. So moving on then, George, May has set the bar very high, but I'm sure you can leap over it and tell us where you are and tell us about the work you're doing, please. And then we'll allow some time for questions at the end.
Thanks, Brian.
Pleasure.
If my video could be activated from admin, that would be helpful. And while I bring my screen up, I will just say that there is, of course, there we go. I can start my video now. Hi, welcome everyone. Of course, there's roadworks happening as I present to you. So hopefully only my ears can hear it and my microphone doesn't pick it up.
We can hear you.
Terrific. And can you see my presentation screen?
Yes, we can just now. Yes, coming up.
So thanks, Brian, and also thanks, Mayo. You've really set the scene quite clearly, and I'm pleased to follow from your speech because, as you indicated, some of what I am about to speak to is some of the real detail of how, in practice, these things have played out and what some of our thinking is for the future. So I'm going to talk about the upskilling and reskilling of the European healthcare workforce, the needs and the policy context, and this falls under the work that we did under the EU Health Policy Platform. So I'm George Valiotis, and I'm the Executive Director at the European Health Management Association. And a bit about the European Health Management Association is really our vision is excellent health management for a healthy Europe. And the way that we do that is by looking at the spread of knowledge on effective health management. So it's all about knowledge and training. We stick closely to our values. That's really important to us. And what's unique about us is that in Europe, we're the only membership organization that brings together European health and hospital managers, healthcare professionals, educators, academia, policy, decision makers. It's a very diverse group of people, and that's critical for our work. And I think it resonates clearly with the key messages today, which is around joint working. So I want to tell you now about the European Health Policy Platform Thematic Network. EMA and Health First Europe were the leaders of this network, which had over 31 stakeholders and across European health and care systems with the relevant experience to inform policy discussions and to define the healthcare challenges, looking at education, training, upskilling of the health workforce. The goals of the Thematic Network were to support the Commission and its member states in profiling the health workers' needs and identifying and improving their core competencies for the future of care, as well as to point out the critical role of the Commission in the debate about health systems reforms, digitalisation, and new models of care. So we produced a joint statement which drew on the comments and information provided in the activities of the network. Now, this joint statement presents a list of best practices in the workforce education, which can be shared across borders. It speaks of the skills of the workforce and to the future role of healthcare professionals in providing data-driven innovation. Now, importantly, it does promote patient-centered and interdisciplinary models of care, as we've well touched on today. And the best practices are clustered into 4 thematic segments, which you can see listed here on my slide. Now, additionally, the joint statements identified the core competencies of the workforce of the future, and it presents a set of concluding policy recommendations. Now, all of these things I'm going to cover in a bit more detail in the slides that follow. So let's look at the 17 best practices. Now, the network highlighted 17 of them, and they include pan-European projects, organizational initiatives, as well as local and national activities. Now, they provide examples of meeting the needs of patients with chronic diseases, digital skills of healthcare workers, promoting health professionals and students' mobility, and workforce planning. Now to the core competencies. So in order for those, so thinking of those 17 practices I just showed you, you need to have these competencies in order to achieve them. And to identify them, Thematic Network surveyed 103 respondents, and this is what they told us. So adaptability is one of the core competencies, person-centric communication skills, digital skills, of course, basic health data analysis, management skills, interdisciplinary teamwork, and administrative skills. Now, I'm sure as you all look at this slide, you think, yeah, of course, oh, that makes sense. What's interesting for me, though, the way that we've presented them here is this is them in order of importance, which was indicated. So obviously, thankfully, admin skills coming last, and adaptability being the most important thing, second, followed by person-centric. Of course, we then also had developed some policy recommendations, and many of them are already being discussed or addressed at the EU and national level, which is great. Our goal is for these recommendations and best practices to encourage more ambitious innovations. Now, the first set of recommendations that I've got on my screen here show, they speak to the important role of the Commission in facilitating cross-border mobility of the health workers and students as well by supporting member states to create harmony, foster international exchanges, and create more opportunities for learning abroad. I mean, these are things you might have questions about, and these are things that we really are open to debate about. So, because I think these do challenge maybe some of the traditional ways that we've been working in the past. So let's go to the other set of policy recommendations. which again, we'd love to hear your opinion. So think about your questions now. And if you have any questions about these, type them into the chat so we can get to them shortly when I finish. So these ones here on my screen speak to the content and the format of training of the health workforce. So core competencies in undergraduate training, interprofessional learning programs, new tools, including virtual training, of course, and access to healthcare occupations being widened. And so this point was really about saying, how do we make it easier for people to enter healthcare in different occupations that have easier entry criteria and have a better focus of on-the-job learning to make them more accessible and to address inequality. So, of course, in the past year, COVID-19 has forced university programs to increase their offer of virtual and e-learning classes. Now, health authorities also had to be creative to quickly implement training to increase skill mixing and to recruit more people into the health workforce. And I think that's what you'll see reflected really in those tools. But like I said, in those, policy recommendations, keep your questions coming about them so we can speak to them in a moment. So to finish up, I'm going to tell you about the range of EU initiatives as examples of what we want the best practices and the recommendations to inform. Now, I'm sure these are familiar to all of you. Great to see such great attendance in the room as well. And I'm sure you'll all be very familiar with these, but I'm just going to say a little bit of info around them. So for the Pact for Skills is about promoting a culture of lifelong learning, building strong skills partnerships and monitoring skills supply. The Digital Europe program is supporting the design and delivery of specialised programs and traineeships for the future experts in key capacity areas. Also, what that program does, the Digital Europe program, is it supports the upskilling of the existing workforce through short trainings reflecting the latest developments in key capacity areas. So those are two of the things we want to influence. Same thing with the, or we want to see these innovations coming from. For the Erasmus Plus program, increased mobility and cooperation initiatives and a focus on core competencies, specifically again on digital skills. And the EU for Health program, which Maya had mentioned earlier, to establish a culture of training resources for a reserve of medical, healthcare and support staff and strengthening health data and the uptake of digital tools again. So lots of digital stuff there, as we've well been pointing to. Just a bit of a technicality about, maybe some of you will know these words. They certainly were new for me when we first came across them. Because what happened was we became delighted that there's a strong consensus among the members of all the stakeholders around this topic, and they want to see more of a drive and more ambitious initiatives to build on what we've already done. So what this means is that the Thematic network has now transitioned to become a stakeholder network in order to build a community of practice around the skills of the health workforce of the future. What that means in like real terms is we ran this network for the last year or so. It went really well, and it was called a Thematic network. And because it did really well, we thought, let's make it a more permanent thing. So it's now called I forget the words, but it would be on my slide. It's become a stakeholder network. There you go. So the network will continue to highlight best practices, and it will revisit the scale up of the survey that we mentioned earlier. It wants to strengthen that to have a better evidence base to identify really more core competencies of the health workforce in general. Build on its previous work to identify more concrete areas for action by health authorities to support pan-European collaboration. And also, if you're interested in joining the network, then simply email us policy@emma.org, because everyone's welcome and collaboration is what it's all about. So that's me, and I thank you for your time, and I'm ready for your questions.
Thanks very much indeed, George. There are quite a few questions coming in, so I will do my best to merge some of them. The first question comes from Lars Munter from Nordic Health 2030 and the Danish Committee for Health Education. I'd like to see a holistic approach to build skills for health from young to old. So to summarize, thank you for the question, Lars. To summarize this, people often ask, what is the scope of what you and Maya are doing? I mean, I understand, and it is a huge topic, and there are many aspects to it. Now, you've selected, in my opinion, rightly, the digital skills. Who will that apply to? Identify just for this audience, what either of you, Maya or George, who do you see as your target audience? Who is it you're trying to give skills to?
Maybe I'll just start that.
Please,
I
Maya.
think, yeah, I think it's a good question, and obviously we're just focused on the health agenda for the moment.
Sure.
But within the EU, of course, the fundamental issue is about skills as a whole, and definitely this idea of lifelong learning. And that's why I want to thank George, who actually did my job for me, but at the end showing those showing the different EU initiatives. I think I got too carried away with the outcomes of the roundtable. But definitely, this is absolutely a cross-cutting issue in general. Skills for Europe, because we're EU, and it is. I mean, as George said, the Erasmus program is also looking at this issue. So I think within the Commission, that's why there is this skills agenda. It's very much one of the key issues, and it covers sectors and it also covers ages. And there's, as I said, a very strong push on lifelong learning, which I think now we can really capitalize on with the fact that we've got so much digital training and virtual training possibilities.
Indeed, great. George, could I just come to you and a similar question, but also to ask, how do people, you said everyone's welcome, so they know how to email you and get involved in your, I think stakeholders, I think was the term we eventually came to. So I would encourage everyone, would you encourage everyone who's on this call, they come from different backgrounds, that's the point of it, an ecosystem, bringing the silos and the different players together. Would you encourage them to connect with you so that you can, please do?
Ryan, thanks. And nice to see you, Lars, in the audience. And thanks for that question. And it really is for a diversity of people. And if you think back to the policy recommendations that I shared, we even talked about access to healthcare occupations needing to be broader. Like we need to create easier opportunities and maybe think more differently about what the workforce could look like. In terms of who would be best for this network, like really you want to have an interest in digital skills or in skills, the future skills for the workforce, not just digital, but any of the future skills for the workforce. If you're not sure and you want to have a chat, like just message me. We're a small organization, so if you do email that seemingly generic email address of policy@ema.org, like we're a small.
That's you, is it? Is that you, George?
Quite me. It's someone who sits digitally next to me, and so like if you're not sure, get in touch and let's talk it through. Really, I think Maya's point around joint up working and collaboration is the key thing. We need to be having these discussions, like this important webinar that we're having now, but even more intimately. So yeah, get in touch if you're not sure.
Okay, thank you for that. Another couple of questions we'll try to fit in before. We've got about 6 minutes left. And by the way, just so as everyone understands, the chat will be recorded by our ECH Alliance people. This whole session is being recorded, and we will try to respond to any questions in writing if we don't get to them in this session. I'm Giedre from, excuse me, not attempting to pronounce your surname, but the Lithuanian Biotechnology Association. You have asked a question, which is the issues of national digital infrastructures, you know, the robustness, because everybody's at different stages in Europe. How's that going to be addressed? Are you hoping between Maya and George to actually understand what each country is doing and try to provide them with tools and funding, etc., to encourage them to adopt the policies and the recommendations? Is that how you think it should work?
Maybe I'll kick off
Please,
here.
Maya.
So basically, I mean, yes, as you know, this commission has identified two key priorities. One is the green transition and one is the digital transition. So we are working on the digital area in all the different sectors. In the health area, we will be proposing by the end of this year, a new European health data space. And the idea around that is really to look twofold. One is to provide citizens and patients with medical data, with their own medical records and more that they can carry their records with them. And the second part of that is the use of the secondary data. So trying to find ways within working with the member states to be able to anonymize data and to make all of the health information that we receive, that we can use it for research purposes and for policymaking purposes. We absolutely understand that each country is at a different development, but we work very closely with all the member states in trying to see where we can provide technical assistance. And also I wanted to bring in George's point, and I think it's very important to think now about this idea about training doesn't necessarily have to be within each border, that let's look at possibilities of cross-country training using digital skills, or hopefully when we can all be together, even face-to-face seminars. So I think that it's two different issues. One is how we can really galvanize support from all different stakeholders to see how we can build interesting training programs, how we can really push the agenda of the health workforce skills. And the other issue is more, as I said in the beginning, the more regulatory framework aspects. And there, obviously, we work with member states to make sure that the regulatory infrastructure is also there.
Thanks very much, May. I'm trying to fit in as many questions as I can. First of all, thank you to all of the ecosystems from Lithuania, from Flanders, from Denmark, etc., who are joining us and asking questions, and the case indeed from Melbourne in Australia. George Margellis, who's from Australia, and at long last, George, you and I speak at a time when you don't have to have your pajamas on just as you go to bed. We're getting you at a more reasonable hour in the evening, I think, your time. And that's something we're learning a lot from the us aged care industry, Information Technology Council, who we referred to earlier. They've made a lot of recommendations and implementing. So we as the ECH Alliance are keeping an eye on this if we possibly can across the world to understand. We don't want to reinvent the wheel, as none of us do. A couple of other quick questions. Here we are. Here we are. There was a question there, which I'm just looking down the chat. I want to go back to, and that was this whole question of, from Christoph, who says, will the skills analysis and recommendation of skills needed be linked to frameworks like ESCO or others? Does Maya or George want to attempt to answer that?
I think what I'd like to add to that is...
George.
Yeah, it could well be. I couldn't speak to it specifically, but I'd be happy to follow up on that. Really, the key points that I was presenting about was around harmonizing curricula and so finding common competencies. So I think it really depends, like the way that these networks work is it depends on who's involved. And all you need is the right person from the right organization. And then, because this even speaks to earlier questions, like the one from Lithuania, I can guarantee you all of us are reading these comments, and even if we aren't speaking to it in detail, I'm already thinking, I'm sure the ECH Alliance are going, all great ideas, and writing them down, and we're doing the same. And I'm conscious of the projects that follow, like Dish and iRaise, that we're also part of, that as people see those unfold, you'll find ways to connect, and it's about the right people having the right conversation at the right time. There's no particular strategy in the group right now to specifically reach out to those, but these are the things that are on our agenda. And if you want to take them forward, we're up for that. We'll hear your views by get yourself involved.
Thanks very much. Well, obviously, one of the obvious decisions, which I'm glad to say I can probably make on behalf of the Alliance, is that you already know us well. We would certainly be keen to build on the relationship we already have, George, because I think it's important that our quite large network now feels it has a voice, because that's very important. Some people have brilliant ideas but never feel they have the right connections to make their voices heard. And part of our job is to make sure that you and Maya are aware of what we are doing and want to collaborate with you in your work, because together we can do a lot more than we can do on our own, I think. At this stage, and thank you coming in from Israel as well and from Finland, I told everyone we were going to stay on time, so I need to do the same. So I just want to say thank you for all your questions so far. And I know we haven't answered all of them, but do bear in mind we will be back in touch and take up George's invitation to connect with him as well, please. We need to say thank you very much indeed, Maya and George. Thanks very much. In a short time, you got a lot across to us all and got us quite excited about what is a great topic anyway. So if we may, thank you both, and move on to the next panel. And I'm being told I need to rush because I see the page is already up there. So I will pass this on, if I may, to Natalia and ask you to pick it up from there, Natalia. So you have 30 minutes, I think, isn't it? Yes, 30 minutes.
Thank you very much, Brian. Good morning, everybody. I am Natalia Allegretti, International Project Manager at the ECH Alliance. Quite clear from the previous presentation how much professional education and training programs can support bridging the gap between the ongoing digital transformation of the healthcare systems and human adaptability capacity by supporting the enhancement of those skills necessary to fully embrace the transformational benefits that innovation in science and technology can bring to the welfare sector in general. One of the European initiatives partnered by ECH Alliance is the Erasmus+ DISH project that focuses on the present and future digital needs of the healthcare workforce. By establishing triple helix partnerships in the 6 countries involved in the project, consisting in healthcare providers, educational institutions, and enterprises, DISH has developed 3 concepts aimed at facilitating the enhancement of digital skills and innovation readiness. The concepts, namely the Learning Innovation Unit, on-the-job training, and the assessment of skills, are currently implemented and used by the DISH Triple Helix partners to offer training activities and related services and products. The DISH testimonials present today, all members of the ECH Alliance Regional Ecosystem Network, will shed light on concrete experiences to stimulate the adoption of innovation by using the DISH concepts. Kristin Oye, professor at the Faculty of Health and Social Science at the Western Norway University of Applied Science, will kick off this panel discussion, giving us an insight of the Learning Innovation Unit in the Norwegian Triple Helix. Kristin, please, the floor is yours.
Thank you. I'll try to share my screen. So thank you a lot, Tank, for the invitation. I will tell you some about the experiences we had in Norway in the Triple Helix, and I will focus on the barriers and promoters implementing our e-health solution in municipality healthcare. This is the experience I'm telling you about is a very small municipality, only about 4,000 inhabitants in that Vaksdal municipality. This is one of 5 other sites that we have used LEO, as Natalia was telling you about, the Learning Innovation Unit concept. So we have used this concept in 6 different sites, and for now it's about 105 staff that has been trained. And I will tell you about one of the most successful stories from our training, and that is from this small municipality, Vaksdal. The other ones has not been that successful, but we will focus on the most successful one. So Vaksdal municipality used the LEAD concept in planning how to do the staff training, and that was implementing electronic door locks. So what I had identified first was a problem, because people, home-dwelling persons, often elderly home-dwelling persons, they had the care staff, the professional care staff, had problems getting access to them. So they identified a problem, and that was actually door locks. They had problems getting in when something happened, and so Vaksdal decided to install electronic door locks to solve that kind of access problem. So the Vaksdal use the LEO, the 7 domains, and the first domain is to identify the value propositions. Why do we do this, and who will benefit from it? So what they could say is that what different kinds of benefits the end users and the staff and the organization, but all of them had some one common agenda here, and one common vision, and that was being safe when you live at home. So even though the end users, they needed safe and fast help and the staff, they did the same. But the organization also wanted to have more documentation to say who had been there, how long they stayed there, and so on. So it was also some kind of deviation control and also anonymization, because with this electronic door lock system. And what they found out in the beginning, based on the vision, that that they had to formulate a communication plan, and this was actually not part of the LEU concept. It's not one of the domains. So they wanted to address the key recipients and how to communicate towards these participants and the recipients of this door lock. And also they formulated the key activities, but instead of just listing up the key activities, they formulated that as an action plan, what to do and when to do what. And they also, of course, identified key participants and also to allocate tasks and clarify the kinds of roles professionals had, and also identify some super users, which they trained early in the process. And one thing they found that was very important to identify is also the resistance among the participants, among the staff, because there is always resistance when something new is being implemented, as you probably all know and have had some experience with. So what they did is to give the resistant participants key tasks and responsibilities, and that's sort of to take down the resistance at that point. And also they saw that they needed some key resources, of course, and they identified a time frame for this and the training and the follow-up. And what they found out during the training is that the availability of technical support and super users was very important all the way along, because there were always some problems popping up along the way. And another thing, which is the fifth domain of the LEU concept, is mechanism of technology adoption. So they also found out that leaders on all levels are, of course, important, and to have some kind of commitment to this, and they got follow-up tasks and responsibilities when errors happened. So, and also that goes with technology leaders in the municipality. And this is also part of a strategy plan in the municipality. They wanted to build a positive learning culture all along the way. And so this is also something the politicians and bureaucrats and others were well aware of, to give the frame that they needed to do this successfully. And also that there was a frame for in the LEU concept for multidisciplinary collaboration, and they also worked in interdisciplinary teams here and were clear about the roles and responsibilities and tasks to be executed along the way. And of course, what they also saw that during the way, they also did some evaluation along the way, and to make visible the quality benefits and celebrate the victories whenever they had done something successful. They celebrated. So what we can learn from this lessons learned implementing these electronic door locks is that we have identified some promoting factors and hindering factors. Of course, the promoting factors we have learned from this is using time to plan staff training and identifying an early stage promoting and hindering factors in the contextual circumstances. So, and also to be very well aware of in the communication plan, what are the purpose and what's the value of this, what is the added value, to see how people can uptake the kind of e-health solutions that they find it valuable. And what we learned is that, you know, using electronic door locks does not mean to change professional ways of working, the kind of habitus in a radical way. It's not like doing care or social care in a very different way. So this might not be very, this is different from other projects and other kinds of e-health technology implementation that we've also learned from this project in the other municipality so far. So I think to look at what you are implementing and the kind of complexity in the innovation is crucial to say if it's successful or not. And of course, this also goes with involving leaders on different levels, including technical leaders. The technical leader was not involved in the beginning of the planning process, and that was a big error. So we learned that they should also be included, also planning the whole process. And as I mentioned, formulating a communication plan at an early stage. And they also identified and made resources available also at an early stage to follow up the training, and also actually not only all the way along with the training, but a long time after the training, because training is always complicated and until the training is accomplished. So it's still going on. They have available resources still, even though the main training has been completed and accomplished so far. So the hindering factors then, so what did we learn about that? Technical errors happen also in this case. The first training of the technology support went actually smooth, but when they got the second delivery of those door locks, something had changed. So the janitors had to go through the training once again because there was some other kinds of technical problems not experienced in the first round. So, and also then it was important to clarify the responsibilities also with the technical staff. And also a hindering factor early at the stage was the resistance among staff. So how to use the lead concept to identify the hindering factors and also the resistance among the staff to overcome that kind of barrier. I don't think the success had been that successful, actually, the implementation. So thank you for your attention so far. If you have questions, I'm delighted to answer those later on. Thank you.
Thank you very much, Christine, for this very nice presentation about one real implementation of the Learning Innovation Unit. Now I would like to give the floor to Henriette Hansen, team leader and project manager at the South Denmark European Office and DISH project coordinator, that will highlight how the Learning Innovation Unit has inspired the development and publication of a mini guide for the successful implementation of new technologies. Henriette, please, the floor is yours. Share your screen. Thank you.
Hello?
Yes, Henriette, we can see you.
Yes. Okay. I'll try to share my screen then.
Thank you.
So, can you see it now?
Yes.
I just changed the... So, okay. So, yes. Hello, everybody. My name is Henriette Hansen. I'm coming from the South Denmark European Office. So, being a part of the health ecosystem in South Denmark. I'm invited today to present this Learning Innovation Unit concept that Christine has just given a concrete example of. I just want to just to sum up a bit what this project is about, and also especially in continuation of the speak from Maya and George, because I actually think that listening to them, you can really see how this project actually speaks into what they were saying, even though that it was developed in 2018, before this roundtable that Maya was talking about. So we are looking really in this project on this missing link, which we have recognized in our project as being skills within the healthcare workforce in relation to innovation, readiness, digital skills, implementation, and change management. So these are really the key points that we are working with in the project. And for that, we have, as Natalia also mentioned in the beginning, developed these 3 connected concepts. And as you can see, we have tried here in this visual figure to show how they are interconnected, because the idea is that you set up a learning innovation first to discuss all the issues around the digital solutions. Then you provide on-the-job training. And after that, you do an assessment, both of the training, but also in relation to the healthcare workers, so that they can actually get a diploma on what they have learned, and also to support mobility, both within the sector, within a country, or even within Europe. So I'm going to talk to you a bit about this learning innovation unit. And just to also put, I say in brackets, what we are talking about here is, we know that very often we talk about technology. I remember in the beginning when we had the European Innovation Partnership and I was doing presentations, I always said something about it's everything but technology. And it's more or less true. We know that when you want a technology to work, 20% is up to the technology, but the rest, 80%, is about behavior, culture, structures. And also I think that Maya mentioned in the beginning something about trust. So trust among the healthcare workers, trust from the healthcare workers to the management and so on. And the Learning Innovation Unit that we have developed in this project, you can understand it as an organizational concept, somewhere to start, to set up a unit where you can talk and maybe put words on all these 80%, which is so important if you want the technological solutions to work in the healthcare sector. So we understand this unit as a kind of co-creation unit where all members and partners, they are equal. You can talk out of the box. You can talk about barriers, promoting factors, your anxieties. How do we do to make these technological solutions work? So you have to look at this as a way of agreeing upon, so what is actually the urgency in our workspace? Why do we want this technology? How can it become better for us? But what do we need to do together in order for that to function? So you need to work on a kind of common understanding, both on a management level, on a staff level, with those who are going to provide training. And maybe also even a company can be part of this unit to talk about their specific digital solution and put it into the frame and understanding of the given workplace. So the Learning Innovation Unit is really about supporting the implementation. And the dialogue that we imagine that you could have in this Learning Innovation Unit should stimulate different kind of things. So what we have mentioned here is, for example, an explorative behavior, that you in this unit, you're not frightened of asking, in brackets, stupid questions or showing your anxieties, and after that you can explore common solutions. So it's about supporting the implementation and the management process, It's about supporting all the competence and skills development needs that both management, but also the workers can feel and see in relation to these digital solutions. And then, of course, create a broad collaboration between the different stakeholders in the healthcare provider. A very important principle that we have put into this concept of the Learning Innovation Unit is that it's building on shared decision making, because it's all about that you all understand what it's about, and you have the common understanding, and to reach that you also need the shared decision making. So now I will go a bit more into details with the Learning Innovation Unit. Christine, she also already mentioned a bit these different domains. And it's our Danish partner, Welfare Tech, who's actually our primary member in South Denmark of the ECH Alliance, who has been responsible to develop this concept. So in this project, we have a triple helix partnership in all the 6 regions that we have as partners. So it's a healthcare provider, it's a educational institution, and then it's a cluster of a health cluster, so gathering the enterprise side. Just to say that this project is a Erasmus Plus project, and it's a sector skills alliance. So that's also one of the reasons why we have this triple helix partnership, really to make sure that we are covering the entire sector spectrum, you can say. So yeah, they have been responsible to develop this concept, which is now implemented in our six partner countries, as Christine was just mentioning. And I will try to take you through a bit the different domains that we are working with in the Learning Innovation Unit. So the first phase, it's developed into 3 phases, and the first phase is then the preparation phase. So how do you actually prepare the implementation of the new technology? What kind of questions do you ask yourself when you want to make a good planning and preparation phase? What is the plan? Who should be involved? Who are the key stakeholders in this planning situation? And also making sure that this new technology actually generates value. So why do we want to implement this technology? Who should it be beneficial for? Is it both the healthcare workers? Is it also the patients and so on? And what kind of value will it bring? You can see the links that we have put here in the presentation. It will direct you to our website, where you can read much more in details about the different domains and the different questions that you can ask yourself in this process. So the second phase is the planning phase, where you look into domain 3 and 4. So it's about the planning of the implementation phase. What do you actually do when you will implement this new technology? And what activities do you agree on? You're supposed to go through all these domains within the Learning Innovation Unit, together with the different stakeholders, to have a common understanding and a common agreement about how you actually do these things. So the 4th domain is about pointing out and gathering the key people who should support this implementation, and make sure that they are an integrated part of the entire process. So encouraging.
Henriette, sorry,
yes,
just
I have to speak.
You should conclude.
Yes,
Thank you.
okay. Well, you can see all these different domains here, and how it works is that we have these Excel sheets with a lot of questions that can guide you through the entire process. So this is Karen. from Welfare Tech, and she's our colleague who has developed this concept and has written all the interesting articles. So you can go to these web pages if you want to know more. So thank you for your attention. I'm sorry that I had to speed up a bit in the end.
Thank you very much, Henriette, for all this very appropriate insight of the Learning Innovation Unit. Let me give the floor quickly to Vicente Travers Salcedo, Research and Innovation Manager at the Institute of Applied Information Technology and Advanced Communication, Universidad Politecnica de Valencia, that will give us an overview of methodologies to improve healthcare staff skills and boost innovation adoption. Thank you, Vicente. The floor is yours, and thank you for closing this panel discussion.
Okay, thank you. Good morning. This is Vicente Traver, and let me first of all appreciate my gratitude to ECA Alliance for this invitation to this event. I mean, coming from a university and always looking for impact in real care setting, is crystal clear that we need to go through, that we need to push for the digital transformation in health sector through scaling healthcare professionals. Most of the thoughts here are coming from this project where the Valencia Triple Helix ecosystem is involved also, in this case, through two universities and one hospital, and our region is also active in the ECA Alliance ecosystems. So just to speed up this digital transformation, we need to generate evidence. Therefore, I would like just to raise some messages to take home. Coming to the point of education, we need to get the root causes, why that's happening. And as we want to improve our health outcomes, we need to be fully aware about the main factors and the amount of data generated, because mostly we focus on clinical care and not on the rest of dimensions. So please focus on the data generated by clinical care and the different social determinants of health, where we need also to put the focus, and that's a key part. Another issue is that when we are talking about digital transformation and proper training, we need to also to avoid another typical misunderstanding. Also, when you are going to a hospital for training, digital transformation is not just digitalization. It's not just a matter of technology. As usual, we are just presenting this from three different and complementary overviews. And digital transformation implies a change in the model about how things are happening. So that's very important, all the concepts that Trine explained before. Protocols are different. When in the past I was calling my girlfriend with the fixed phone, most of the times the parents were taking the phone and the protocol is at home, could I talk to her? Nowadays, with the mobile, protocol has changed. Now I know who is on the other side of the phone, and my question is, are you available? Can we talk? So the same applies to healthcare protocols. This is not a matter of technology tools. We need to understand how all those changes are happening. And for such digital transformation, we need to bring evidence. It's not enough with that it's just working. It needs to work better than previous solutions. And new added value has to be explicit to avoid a reluctance to change. If you are training about innovation, you want to make changes, but you are not convincing your audience with evidence. The task is really, really difficult. So going to the point, how we generate evidence and which type of evidence. The issue is that we need different answers to that question, but what is always true is that we need to get different truth views to get the real truth. And that implies to have the involvement of different key stakeholders in the innovative process that we want to introduce. And again, that's reflected in the new concepts. So just to reinforce this point from a different perspective, evidence or the truth is not just coming from the clinical side. We need also to consider the patient side with the prompts and the trends, because patient at the end really, really matters. All this process is what we are currently running in the Erasmus project, following in an iterative model those three aspects that I'm going, because of the time, I'm just skipping, but Trini explained perfectly the learning innovation units, on the job training, and the assessment of the recognition of such skills. Concerning all this stuff, it's also worth to mention the study led by Eric Topola 10 years, some years ago, about preparing the healthcare workforce to deliver the digital future. I think that's a good point also to think about. So some messages just to end and to take home. First of all, healthcare professionals need training programs about digital health technologies. That's a need that all the speakers are mentioning. About the learning innovation units, they are a very powerful approach to handle the knowledge and train professionals to boost innovation adoption. Also, we need to share lessons learned, as we are doing today, from early adopters, and push also for the effective digital transformation, but always coming from the evidence. And we need to look for collaboration with the industry, I mean, not only industry, the whole ecosystem, to improve healthcare staff skills. So that's all. Thank you for your attention. And please, if you think you are too small, try sleeping with a mosquito. We can make the difference, and we are not so small as Andy Bliden was showing us before. Thank you all. I'm ready for questions later. Thank you.
Vicente, thank you very much, and thank you very much to all my panelists. Brian, there is just a question in the chat box. Maybe more than once, but we are a little bit late. So if you want to proceed, maybe we can deal with the questions offline, let's say.
No, I mean, I'm quite happy, Natalia, if you want to take a minute just to ask one. I know there's lots of questions. Maybe just paraphrase one of them. And
yeah, there is one from Jakob. I cannot pronounce the surname. I'm sorry.
I know Jakob well. Hi,
yes.
Jakob. Good to hear you.
And the question is, how do you deal with the reimbursement impact of the innovation? So maybe Vicente, would you like to get back on this?
Okay, that's a very good question, because yes. First of all, from the reimbursement point of view, it's not easy, and we are not addressing in the same way from a public or a private perspective from one side. But that's true that we need to measure that. I mean, if we are talking about evidence, or we need to convince when we are running Erasmus Plus projects, we want to generate evidence just to convince our policymakers, and that's one dimension that we need to assess. So I would say that the reimbursement impact has to be identified through different indicators just to go through, because reimbursement, okay, is sometimes we are talking that we are saving money, but okay, that saving money is just from the clinical perspective of the healthcare provider, but not from the patient perspective. So we need to find a balance and put all the topics, all the expenses in the balance, and just go through. But that's something that has to be measured for sure.
Thank you. And quickly and concluding, somebody is asking for links to have more information about the project. So Paivi, I will send everything in the chat. Thank you very much to all of you, and Brian, please, and Diane for the next
Thanks
session.
Very much indeed.
Thank you.
Thanks very, very interesting panel. The difficulty with all panels, it seems to me, is they answer a number of questions, but they also pose a lot of questions. So we never ever seem to have time. That's why we want to have this as a permanent ecosystem as opposed to a one-off workshop. So let's move on then and keep to time. I'm delighted now to introduce you to Diane Nevin, based in Dublin, who works with us as an ecosystem strategy manager. Your next panel is in your hands. Over to you, Diane.
Thank you, Brian. Much appreciated. Good morning to everybody. I'm thoroughly enjoying this session, very innovative and fantastic insights, so well done. So I'd like to go through our panel of experts this morning. Our first speaker is Maria Teresa Parazzato. She's an executive director of the European Specialist Nurses Organization. Our second speaker is Professor Martin Curley, which is the director of the Digital Academy, the HSC within Ireland. Rosanna Alestrello, the value-based procurement director with the Agency of Health Quality and Assessment of Catalonia. And Dr. Sanna Rimpelainen, the Research and Skills Manager of Digital Health and Care Innovation based in Scotland in DHI. So our panel discussion of experts, we will focus on open innovation approach, to co-create the future of healthcare services. Okay, so I'd like to hand over to Maria Teresa to share your slides.
Okay, thank you.
Thank you.
I will share the screen if I can. Yes. Well, yeah. Can you see it?
We can see it. Well done.
Okay. Can you see it? Yes?
Yes.
Yeah, okay. So I can start now to speak about the digital skills needs in the nursing sector and the impact of digital innovation on nursing. So if we ask to ourselves if all these revolutions in technology, because I have to say that in such a short period, we really got a lot of revolution in technology. Do they really matter for nurses? Well, of course, the technological change has transformed how healthcare is delivered globally. The digital technology must be embedded within healthcare environment. There will be more of a focus on the development capability of nurses and to work, to care, to use the digital. So, and this will change in a way also the professional identity formation. The digital professionalism has emerged in response to the need for healthcare professionals to understand, develop, and know in an appropriate way how to behave while using digital media. But still, currently, there is not an accepted standard definition of this term. There is a paper, this paper here, New Technology in Nurses, that contributes to research into the interconnection between the new digital technology, the work of the nurses, and their professionalism. In particular way, if we consider the relation to theoretical debate about technology, shaping the skill set and work processes associated with patient care. So the healthcare is being radically disrupted in a way, because we really have to change our mind and to change our way of caring for the patients, but without forgetting the human aspects of the nursing care. So if we look at the power of robotics, what can we say about it? Well, the first question is, business is changing. Will you adapt or be left behind? And of course, the answer is we will adapt. So we cannot afford to ignore how this issue will transform the landscape of business in society, including the healthcare sector. And if we speak about robots and artificial intelligence, we can see that in 2021, the artificial intelligence market for healthcare is projected to reach 6.7 almost billion. And the one for the robots in healthcare, 2.8. So currently 63% of the healthcare executives worldwide are investing in artificial intelligence technology. 74% of executives plan to invest, and only 31% believe artificial intelligence is the most disruptive tech in the industry. If we look at the consumer, you can see that also they are slowly changing their concept. So we have now 54% of patients being open to receive artificial intelligence enabled healthcare. 37% are okay with monitoring their heart condition. 35% are open to AI checking their heartbeat rate, etc., etc. So you can see that the society is definitely changing and preparing. All people is preparing themselves to go in the direction of technology. What's coming next? You can see that the advanced practice registered nurses can help the organization prepare for, implement, and adapt to this promising transformation related to artificial intelligence and technology. For example, they can develop an open database warehousing infrastructure, analyze the data asset, establish safeguards and security, so help to do that. Create firm foundation of data governance, educate the staff about the importance of clear and efficient data governance across organization, etc., etc. So there are several points where the advanced nurse practitioner could get benefit from the artificial intelligence. For example, they can perform duties in niches where the artificial intelligence system cannot enter, cannot be fulfilled by an AI. They can evaluate the output of certain type of patient's conditions and check if what the AI says is correct or not. And of course, also if we go here, they can provide the human element, such as compassion and empathy, alongside artificial intelligence. If we look at the impact, because this is one of the worry sometimes of the healthcare professionals. So they worry to lose the job because of artificial intelligence or robotics. So if we look at it, we can say that the human healthcare professionals are not so much affected, because at the moment, at least, the artificial intelligence and robotics is affecting more the lower wage or the lower education roles. So how can we go on in this direction? There is a need for all healthcare professionals to be digitally literate. Still today, also because we have to consider that the large part of the nurses at the moment are, let's say, not so young. They are experienced person with quite a lot of years of working. So they were not used really so much to use the digital, to use the artificial intelligence or to use the robotics. So definitely there is a need of a training and education program. We have also to redesign the care enabled by digital technologies. And of course, there is a need of user-friendly tools like electronic health record or predictive models that can be help for sure, but they need to be easy to use. And I also consider that the end user should be involved in the development of the digital health system, because at the end, the healthcare professionals are the one using it, so they must be involved in the development. So one question that frequently is coming out, will artificial intelligence or technology replace me? The short answer is for sure no. Why not? Because if we look at the core of nursing care, we can say that although no one can disagree with the advanced achievement of medical technology, however, care is more than cure. And caring is even more than being patient-centered. Care needs to recognize every person as a human being whose experiences affect health and well-being directly. I just want to mention something going back 1 year, if you remember, March, April. I'm coming from Italy, so Italy was really affected by the COVID-19. And there were so many old people dying in the hospital alone. And there are some studies that came out recently saying that if that person would have had the possibility to be comforted by the relatives, probably some of them would have not died, because the human touch is very important. So that's why the nurses need to develop the head, hand, and heart approach, which incorporates for sure the practical know-how, but with empathic understanding and technical knowledge to provide humane and sensitive care. So this is very important. And that's why we say we care for a person and we cure for an illness. We should never forget that we have a person in front of us. So this is the reason why my take-home message is this. Modern nursing must be open to innovation, must be ready to use technology, but should not forget that nursing is first of all an act of caring. Thank you very much for listening.
Thank you, Maria Teresa. That was very insightful, and I love the whole concept in terms of machine learning versus human learning and how they integrate, but we really have to go back to the core, which is the patient-centric care. And thank you very much for that. So we'll move on to our next speaker, Professor Martin Curley, Director of Digital Academy, HSE Ireland. Good morning, Martin.
Morning, Diane. Can you hear me okay?
I can hear you well. So we have your slides, or if you'd like to click in there to share, we'd be happy to.
Share.
Great.
Can you see my screen, Diane?
And indeed, yeah.
Great. Well, good morning, everybody, and thank you, Brian, for the invitation. Thanks, Maria Teresa, for a really excellent presentation. So I want to try and build on that, Diane, if I may, and I'm going to talk about skills for health and what we're doing in Ireland with respect to preparing our workforce for the, what's the problem, what's the opportunity, and what.
I seem to have lost you, Martin. Hello? Yeah.
Right, we're allowing to rejoin. I think he's kicked himself out. If we go to the next speaker.
Okay. We'll move on to Rosanna Lestrello.
Okay, Diane, I'm back, if that's okay.
Yeah, that's okay, perfectly. These things happen.
Okay, so what I was saying is the problem is that healthcare is a decade behind other industries in digitalizing. And in Ireland, we particularly have an acute version of that. We're one of the lowest ranked countries in the OECD for maturity in electronic health records. But there's a great opportunity, and the opportunity, as Maria Teresa talked about, there is a revolution. And unlike before, when there was a single disruptive technology that came along that caused a lot of creative destruction, according to Schumpeter, today we have many disruptive technologies all showing up at the same time. We have
Martin,
cloud, mobile, and social. Yeah.
I do apologize for interrupting you. We can't see your slides currently. If you'd like to share them again, reshare them. Sorry now.
Sure, no, thank you for interrupting.
Great, thank you.
So we have a great opportunity. Can you see my screen now?
Andy, thanks, Martin.
Great. So what we see is that we have all these disruptive technologies all showing up at the same time: AI, machine learning, Internet of Things, blockchain, robotics is going to be very important. And all of this adds up to a perfect storm. So if we can harness this perfect storm, we have a real opportunity to advance. But if we can't, then we have a problem. So what we're proposing in Ireland is actually a leapfrog strategy. We have had a lost decade in Ireland with respect to moving to the traditional digital health model. Today in Ireland, care is based on presence, it's based on paper, and it's based on our acute system. Now, we've had failings in the last decade in trying to implement electronic health records. But what we would like to do is actually leapfrog to a new digital health model where care is primarily provided in the home and in the community. So you almost have a hospital at home. It's based on remote monitoring. You have proactive and predictive health. It's cloud-based, it's open source, it's AI enabled, and so on. And we think we can do this at far less cost than it takes to sustain our current systems because of the power of digital technologies and silicon economics. So we've built a roadmap, and in the next 5 years, we want to move Ireland from being the laggard in Europe to being a European digital health leader. And we're quite serious about that goal. And with COVID-19 as a big bang disruptor, we estimate that we have shifted a maturity level, that we've gone from maturity level 1 to maturity level 2 in the space of just a year. So we have an integrated overarching digital transformation strategy. And there are 5 pillars, and I'm going to talk about the first pillar, which is Digital Academy. But our other pillars are a Digital Academy Forum, Open Innovation, Digital Labs, and lastly, Digital Change. And we talk about the 5 I's. We're trying to inform our workforce and educate them with respect to digital health. We're trying to ignite the ecosystem so that they can develop the best possible digital solutions for us. In open innovation, we try and identify which are the most promising digital solutions. In our digital labs, we iterate the solutions very quickly using agile prototyping and agile development. And lastly, in implement or in digital change, we're trying to implement these solutions. So let's look at the architecture of the HSE Digital Academy. Unlike the NHS Digital Academy, which is focused on CIOs and CCIOs, we actually have the reverse focus. We're focusing on doctors, on nurses, on physios, on pharmacists. We're looking at everything from basic digital literacy skills all the way up to digital health research and PhDs. We're very lucky that we are being able to partner with leading multinationals such as Dell and Cisco and SAS and UiPath to actually build digital transformation training offerings. So our Masters in Digital Health Transformation was co-designed and is co-delivered with all of the 8 Irish universities, with the University of Limerick as the coordinating university. We've just announced a diploma in digital health futures, and I would invite the audience to actually subscribe to this. For the next 6 months, we'll run a 90-minute session each month exploring different areas of digital health futures. And for the attendees at the end, they'll get a HSE Digital Academy and Dell Technologies diploma. So you can search for that and register. We've partnered with the Cisco Networking Academy, and we now offer all of the range of Cisco Networking Academy training offerings to all our HSE employees. And we've about 110,000 employees that are benefiting from that. We've just launched a digital skills, a basic literacy course on our internal e-learning platform. We've also just launched a pilot with SAS on a data literacy training course. And we have been running a RPA analyst and developer training course with about 50 HSE employees. So what we're trying to do is to provide training offerings from the very basic digital literacy skills all the way up to masters and indeed digital health research PhDs. As I mentioned, the masters was co-designed with all of the Irish universities, and here's a picture of the professors that gathered together at Maynooth University to co-design this masters. What's interesting about the masters is that students don't have to deliver a 30,000 word dissertation, but what they have to do is deliver a digital change project across the health service executive. So currently we have 21 digital change projects that have been initiated as part of our masters. And next month we have a video poster review of those. And some of these projects are really impactful and have already made a real difference to healthcare delivery in Ireland. As I mentioned, we can't do everything ourselves. We're using a methodology called Open Innovation 2.0. And this is a methodology, and it's about how do you drive a structural change in an industry using digital technology. And very often we're talking about our quadruple helix. We're partnering with government, industry, academia, and citizens and patients. And as I mentioned, here are just 4 of the companies we're partnering with to deliver training offerings to our workforce at different levels, from nurses to executives, to pharmacists, to physios, and so on. In parallel with our training offerings, we also run a digital academy forum. So our digital academy is about informing our workforce and getting them ready for the digital future. Our digital academy forum is for igniting the entire ecosystem and ideating across the ecosystem to try and bubble up what are the most promising ideas for implementation for digital health in Ireland and beyond. And we've had sort of lots of guest speakers. I know Brian is going to be speaking at our next Digital Academy Forum on June 23rd, but we featured Stevie the robot, who was on the cover of Time magazine, and we've had our own CEO and chair present a number of times. So I'd also invite you to look out for our Digital Academy Forum, and this is about sharing, spreading, socializing and solutionizing new ideas and solutions for Ireland and beyond. We maintain a whole range of digital disruptive technologies, and this is a snapshot of things that we're doing. Everything, for example, using avatars for contact tracing, using drones for prescription delivery. I was speaking at a 5G conference earlier this morning, and at one of our hospitals, Cavan General Hospital, we're going to start a 4G and then a 5G pilot for improving hospital communications. But every time we introduce a new innovation like this, we also have to introduce the training associated with it. So I'm going to stop there and hand you back to Diane. But just to say, we're on a journey from repair care to healthcare, from acute to home community-based service delivery. We want to bend the cost curve. We want to have a real-time health system. We have to have a citizen and patient-centric approach. And all of this can only be enabled by having the appropriate training in place for our workforce. And that's why we have the Digital Academy in Ireland. So thanks, Diane, and thanks to everybody for listening.
Thank you, Martin. We'll take questions at the end, but just a comment for myself. I just want to congratulate you again on the work that you're doing within Ireland in terms of the Digital Academy. It's really innovative, and we can see the progression throughout our healthcare system. So well done. Thank you. So we're going to move on to our next speaker, Rosanna Elestrello. Good morning.
Good morning. I'm sharing now my slides.
Great, thank you.
Can you see my slides?
I can see your slides. Perfect. Yeah, thank you.
Very well. Thank you. Well, so thank you very much for inviting me, and to make part of this really such amazing event and such amazing panel. So let's hope that I can keep the level high with the rest of the panelists of today, and also for sharing with you our lessons learned from our Appraise education program that we had the first edition last year, and now we are rebranding it in iRaise, and this will be the edition of this year. This is a co-funded education program by the Health, and really it's really tight and focused on the building capacity and upskilling for the professionals as the theme of today from their healthcare organization. And we see that this is really a key element, this upskilling of the different professionals. So we are not talking about healthcare professional healthcare organizations for the uptake of digital health, with the meaning really that Maria Teresa Parisotto highlighted the first session of the first panel session of this panel, that we are transforming the act of care, but still it's an act of care. So we don't need to really to focus on digitalize everything just for the sake of digitalization, but so only if it makes sense and brings value. Also this value aspect that Harriet Hansen was highlighting in her intervention. We need to make sure that new technology creates value. This is really what Appraise and iRaise are aiming for. So if we, 1 second, okay. So why we are talking about iRaise and Appraise? iRaise and Appraise really are coming out because we realized from the different literature that less than 25% of public R&D grant, research and innovation grants at the end are commercialized. And more than 50% of public procurements do not achieve the goals. And also, we are far less than 70%, it is the target from the European Union, of public procurement of innovation are dedicated to public procurement of innovation across all Europe. This means that we have a gap here, and we need to convert our belief that we need to convert from one side ourselves as smart procurers that know what to buy, that know what they buy, know how to buy, procure that challenge the market to create what they need if this doesn't exist yet. And and this would allow to boost the commercialization of research and innovation that create that address the real needs from healthcare perspective. And this is a way, one of the way, clearly is not the only one, to boost the industry competitiveness of the EU, mentioned by Maya Matthews at the beginning of today. And it also is addressing the gap of the innovation adoption. To make this happen, we put a consortium together, 7 entities, this year coordinated by Università Politecnica de Valencia, by Vicente Traver, one of the panelists of the previous session. And we are somehow the same consortium of last year, of when we started with Upraise, with a small change. Last year we had on board West Midland Academic Health Science Network, that unfortunately this year they cannot join. And but we are very well replaced by EMA, no, the European Health Management Associations, and you saw also George Bagliotli at the beginning of this today webinar. So at the end, we are 7 entities from academia, from healthcare services, from Catalonia and from Madrid, very knowledgeable regarding the healthcare providers, also EMA. Very knowledgeable in innovation, all of us, very knowledgeable in innovation design, RISE, in innovation entrepreneurship, TIC Biomed, and very knowledgeable also in what is the participant follow-up, participant recruitment from academic point of view, but also from mentoring point of view, IPN. Why we decided to go together, all of us? Because again, we identified that we had a gap in innovation adoption, and we could, together with this education program, upskill the professionals in their health organizations to acquire the knowledge and the skill to make this happen. And the first exercise we did when we started this this education program was sitting together and define what knowledge we had to have in place to make this happen. And we identify that, for instance, one of the basic knowledge is to define what a need is, then to identify what an unmet need is, and how it's important to evaluate what happens if we address the unmet need or we do nothing. That's also important. And this is the challenge, the business case, or also how the market is doing around us. Is it mature to address our unmet need? Is not mature? How the other healthcare providers are doing? And this is state of the art. To know the neighbors and the barriers from regulatory perspective, from why not also political perspective, from different perspective, technological perspective, that can prevent us to or can support us to get our unmet need addressed. And at the end, all of these together can make us smart adopters, will be enabling us to identify the right vehicle to address our unmet needs. Right vehicle, what do we mean with the right vehicle? It could be we just procure an off-the-shelf solution, we procure an innovation, we procure in research and development, we develop by ourselves, then later on maybe we commercialize our procurement, or why not we go through different innovative ways to make this happen, like the social impact bonds. And also we went through the identification of the skills that can support the innovation of adoption. And we are highlighting now the ones that we will focus on during our iRace edition. The teamwork and leadership, the analysis and problem solving, application practical thinking, design and project, innovation creativity. Teamwork and leadership are key, and in fact have been highlighted also by the different panels previous to mine. And I would like to add with teamwork, multidisciplinarity. In fact, if we don't, in our experience, if the key way to define the needs and the business case is taking into account the different profiles in the different multidisciplinary member of the teams around a same issue. And this maybe would address also, why not, the question we had in the Q&A regarding now from Jacob, reimbursement, the impact of innovation, of Gregor, the pilotitis. If we start to think about what we want to address all together, it will be easier to scale up and to know then how the payer will make a reimbursement of such innovation. So from a methodological point of view, we are addressing multidisciplinary teams, and this was very successful last year. We had 14 applications of teams from 3 to up to 6 members, and then at the end we trained 7 teams of them, always with multidisciplinary perspective, and coming already with identifying challenge and going through them together through flipped classrooms, mentorship meetings, and also this year, inspired by the iRace Industry Innovation Alliance members and alumni network, will enable them to, again, to understand how they can address what is the vehicle that they need to pursue to address their challenge, their unmet needs. And so this is our value proposition, no? Hands-on training, a team of professionals from a healthcare organization. So we are not talking just healthcare professional, we are talking also maybe maintenance staff, ICT staff, innovation, all the kind of professional that will then will be affected by this deployment of the innovation, will be affected by the solution to the common unmet needs identified. Promoting innovation to boost demand-driven, because it comes from them, to be addressed by effective and sustainable adoption of innovative digital solutions. Sustainable, the business case is key. This is just a slide to let you know that we are launching in few days the applications with very strong discounts this year, because this year we are still co-funded by the health, and we are taking into advantage of this fora to say that we will have a special discount thanks to European Connected Health Alliance that is allowing us to launch this education program. So I'm done. Thank you.
Rosanna, thank you very much. Very interesting. And again, in terms of your expertise right across the board, knowledge, research, entrepreneurship was really, really interesting. So thank you very much for your presentation. We really appreciate it. So we're going to move on to our last speaker, Dr. Sana.
Yes, hello, and let me just share my screen.
Thank you.
See how I can you see just my screen or my notes as well?
Your screen, yeah.
And your notes.
And my notes. Okay, that wasn't the meaning. Let me just try this again. I did participate in a in a training, but it didn't seem to allow me to do this. Okay, let me just try this one more time. Okay, let's try this. This hasn't got my
no notes. It's perfect.
Okay, can you see this?
Yes.
Your slides, yeah.
Okay, okay. I can't see my notes, so let's just hope that I'll remember them. Okay, so thank you for inviting me to do this talk. Andy asked me to come and talk about digital skills and let me just get my pictures out of the way. Yeah, digital skills and curriculum development across education for the existing and future healthcare staff in Scotland. Sorry, I should say my name is Sanna Rimpilä and I work for the Digital Health and Care Innovation Centre in Scotland, unless that was clear before. Yes, so given that this is rather a broad topic, I'm going to just talk to you about an innovation project that we ran for preparation of future workforce for health and care staff at the Scottish colleges 3 years ago. Before I move on to this, though, I wanted to clarify something conceptually. As we work for the Digital Health and Care Innovation Centre, we constantly come across kind of conceptual mix-up where people mix digital health and care with digitalizing health and care. So digital health and care is what is on the pink side of this diagram, and by that we mean staff who design, develop, deliver and facilitate the implementation of digital solutions to support health and care. And this also includes specialist digital staff working within health and care. And they have a very different set of skills and capability requirements from people who work in the front line of delivery of health and care services, which is the gray side of this diagram, and whose digital skills and capabilities and digital literacies we are also talking about in this seminar and in this presentation. So while it is quite useful to talk about digital health and care in a sort of broader innovation space, when we start thinking about the specifics of skills and capabilities for the different types of workforce within these spaces, it becomes necessary to do this distinction. And this is why we want to promote this as part of our work. So the project I'm going to talk to you about was called Future Equipped, and this is the largest college innovation project that's been carried out to date in Scotland. This was 3 years ago, and unfortunately the subsequent tranches of funding have fallen prey to Brexit and then after that to COVID. But this project, it was co-designed, led and delivered jointly between DHI and Construction Scotland Innovation Centre. And we brought together 3 disciplines, health and care, construction and ICT, which sound quite like a very, very different or a confusing combination to bring together, but we brought them together, the shared or sort of natural connection point of smart housing and independent living. So we engaged with 13 colleges. There are 27 in total in Scotland, and we brought together 27 lecturers and over 500 students into this project. And the rationale behind this project is that as digitalization is transforming the world of work, and so digitalization is transforming the world of work, and both health and care and construction are areas that lag behind other sectors in digitalization between 10 and 20 years. It also requires, so in order for the college sector to produce appropriately skilled staff for the needs of these industry areas, they need to understand where health and care and construction are going, what the future holds for these sectors, in order for them then to understand what kind of skills and capabilities they need to teach their respective students. So we developed 3 distinct work streams. The first one was about engaging with college lecturers, innovation integration. The second one was about student exposure to innovation. And it is these 2 work streams I'm going to talk about in this presentation. And the final one was college business innovation support, but that was slightly different. So I will leave that out of this talk. So we developed a 5-day learning program in collaboration with the industry representatives from the 3 sectors, other innovation centers, there's Data Lab and Census, which is an innovation center for sensors and imaging, as well as college representatives and people from certain public sector agencies. And the purposes of, or the aims of this first work stream were to upskill college lecturers in kind of industry trends and innovations in the 3 respective industry sectors, to provide them with an opportunity to collaborate with their colleagues from other disciplines and other colleges, and also to help them repackage what they learned into a format that they could easily then deliver at their colleges to their students. So this resulting 5-day learning program was delivered over 6 weeks between in August and September in 2018. And the lecturers participated in 5 days of master classes, site visits, hands-on learning experiences, presentations, etc. And they also had the opportunity, there was an overarching project that kind of covered those 5 days, where they had the chance to collaborate with their colleagues and try out agile joined up curriculum design exercises. And this project was the one that kind of allowed them to repackage what they learned and deliver that or integrate the learning into their teaching. The result out of this work was micro-learning library. There were, well, finally, there were 30 units, but these were kind of condensed and edited to 15 or 16 units. And as part of workstream 2, they then integrated this learning into their existing teaching and course provision. And in this way, we reached out to over 500 students. And in addition to that, as part of workstream 2, we also invited 150 students from these colleges, the 3 different disciplines, to participate in 4 separate one-day workshops, which were delivered in a kind of like a mini version of what the lecturers went through. And so what the participant experiences of participating in the Future Equip project were that the lecturers had very rarely had a chance to collaborate and learn and network with lecturers from other disciplines, let alone from other colleges, and the students had the same experience. And that kind of opened up to them the joined up way of thinking that we all have a state of health, we all live in built environment, and there is digital technology. So how can the built environment, the digital technologies, support your well-being, your health, and your independence if you, for example, live with a long-term health condition? So this sort of very, very person-centered approach to this learning experience. They also had the possibility, or they appreciated the possibility to try this agile curriculum design exercises and learn about smart home space and the emerging technologies in the respective sectors, and also to think on how will these then impact the work practices of the people who then enter the sector. What do they need to know in order to be able to work in this kind of new environment? And at the end of this course, there was a 65% net increase in lecturers' perceived ability to design curriculum in response to industry needs, emerging technologies, and innovations. The challenges in this related to lack of time and backfill to cover the participants' teaching time at colleges, even if there was funding available for that. There were some issues with communications at colleges before this course, and obviously there are challenges in cross-disciplinary working, but these were kind of overcome as part of this work. And so generally this project has impacted the college sector positively. There were several colleges who reported that as a result of participation in this project, they've reviewed the strategic direction of their college's curriculum and teaching provision. They've encouraged the college lecturers to engage more into interdisciplinary teaching practices and just generally updated their teaching methods. They've also increased engagement with local businesses in terms of teaching and just generally project work. And they have used the Future Equip themes with their students. And so while this is 3 years ago, the other Innovation Center has maybe progressed earlier on with the kind of learnings from this project. But DHI, as we've been heavily involved in the national COVID response, our response has been a little slower. But we're now developing a national campaign to raise awareness of digital health and care sector as a career option, and also to help with colleges to understand how digitalization is changing health and care and what kind of things should be taught to the care and health workers as they move into this sector. So thank you.
Thank you, Dr. Sana, greatly appreciated. And again, another excellent presentation. We appreciate your expertise and knowledge in digital health within DHI, so thank you very much. So we have a couple of questions. I'm not sure, Brian, if you'd like me to just give an overall question, or would you like to just finalize it and maybe refer to questions later?
I think the difficulty we have is that we're running over time, and I know lots of people have other, so we're going to have to wrap it up there, I'm afraid, as far as the panels are concerned. And just say thank you to all of you. I know we've kept you 2 hours, don't want to keep you any longer, but we're thrilled that you joined us for so long. Thank you also to all the speakers, the moderators and so on. And Andy has typically put up something just to remind us all that this is a permanent ecosystem. Put the 1st of July in your diaries, and you'll see the other gatherings. Do join us. If you're not already a member of the Alliance and don't attend our ecosystems, you should become one. And we encourage you to do that. Happy to help in any way. We will have recordings, the slides, etc., distributed and available to you. So it just wrap up to say thank you again very much. This is the beginning, not the end. And I look forward to working with all of you over the next period of time. Thank you. Have a good day.
Thank you, Brian. Thank you.
Thank you. Bye-bye.
Thanks, Brian. Bye-bye.
Thanks for all your input.
Thank you very much.
Thanks, Rosanna. Thank you, Vincente and George and Martin.
Let's keep in touch.
Yes.
Bye. Bye-bye.
Bye-bye. Bye-bye. See
Bye,
you.
Vincente.
Ciao, ciao.
Ciao.
See you, Brian. See you, Martin.
Bye-bye.
Bye-bye.
Thank you, everyone.
Bye-bye.
Thanks for that, Martin. It's very helpful.
Right. All of us, Andy. Bye. Bye, Brian.
I really like your presentation, Martin. Yeah, I took some thoughts. Perfect. Congrats, Rosanna. Well done. Bye-bye. Ciao.
Thanks, Maria.
Ciao, ciao, Andy.
Ciao. Bye-bye.
Congrats.